One of the government's, the lead headline, according to the government, was making bulk billing more accessible to Australians. To what extent will that actually happen, though? Joining me now on what this will mean, in particular for communities outside capital cities, Assistant Rural and Regional Health Minister Emma McBride. Thanks very much for your time. So the crucial element is getting bulk billing actually going, and that's about incentives for GPs. Can I ask you, what is the average charge for a GP appointment in the regions that is not bulk billed, and why will this measure actually increase bulk billing as a result?
Well, what we've seen after almost a decade of neglect of the former government is GP bulk billing rates just declining all over the country. I was in Tasmania at the Rural Health Conference over the weekend, and Tasmania has some of the lowest rates of bulk billing in the country. So what we've done as a government is we're investing in tripling the bulk billing incentive, and hearing from doctors who had reluctantly stopped bulk billing or were thinking about not being able to bulk bill anymore, we know that this, from having heard from doctors directly, will be a really strong incentive to allow them to keep bulk billing or to start bulk billing again and really strengthen the viability of their practices. So we know that many practices had stopped bulk billing children under 16 or age pensioners, and this is something that we are determined to turn around, and the tripling of the bulk billing incentive will benefit almost 11 million Australians right around the country.
Well, so how many actually, I mean, that's how many can actually theoretically access it. I can't imagine all 11 million will be getting a bulk billing appointment, just to point out on that figure. But going through the math, so you get just under $40 back in terms of the Medicare rebate. This will take the bulk billing incentive to about $19, so close to $60. What's the average fee for a GP in the regions?
We know that people, I mean, one of the biggest things is that people can't get into a GP because GPs just aren't bulk billing anymore. The co-payments have risen, and people are ending up in emergency departments, which is avoidable. What this investment will mean for a typical level B consult, the rebate plus the tripling of the bulk billing incentive will see in MM7 areas, the most remote parts of Australia, the government investing almost more than $80 in a typical level B consult, the most common consult. So what we know from what I've heard from doctors already is that, hearing from Dr. Catherine in the Illawarra this morning, she said she now feels optimistic about general practice again for the first time in a very long time, and that their practice will be able to continue to bulk bill, particularly children under 16 and older Australians. So this is a $3.5 billion investment from the government in general practice and in bulk billing.
I'm just trying to drill down on that gap still, if you like. So you put the math on a level B, the amount getting back $80. What's the average charge, though, at the moment in these regional parts for a level B?
I mean, general practices are small businesses, so what they charge is at the discretion of those small businesses. But what we've done as a government is tripled the bulk billing incentive, giving every support.
You must have also done the math on what they're charging, because if it were somehow way more than that, they're not going to change their incentives. So is there an average? Can you give me any sort of figure on what fees are at the moment?
Well, they do vary, and they do vary on the community that you're in and the type of consult that you've had. But we have seen a significant increase where people are paying $50, $60 more for a typical consult. And as I said, I'm reluctant to put a figure on it because it does vary on the state you're in, the remoteness of where you are. But
okay. Can you give me a state, a city, anywhere where there's an average or something?
Well, as I said, general practices are small businesses, and what they choose to charge their patients is their own independent decision. But we know that the bulk billing rates have dropped significantly, and what we intend to do as a government is to turn that around. And the best way that we can do that is by tripling the bulk billing incentive, which will mean that in some communities, the most remote parts of Australia, the government will now be investing more than $80 in a level B consult, which will mean that the person will be bulk billed and won't have to pay a co-payment.
But to have the confidence that person in that situation we bulk billed, you have to know how much it changes the equation for that GP surgery. I know no two ones are the same, but you must have some figures on average regional costs across the country or a state or something. These must have been part of calculations.
And this is the thing, as I said, a general practice is a private business. What they choose to charge their patients is their own decision. But we know that this is what the Royal Australian College of General Practice asked for. We know that this has been backed in by the Australian Medical Association. And talking to the new president of the Rural Doctors Association, RT, in Tasmania over the weekend, they are very confident that practices that have reluctantly had to stop bulk billing will be able to return to bulk billing, and practices that were weighing up whether they continue bulk billing will be able to do so.
For some areas where demand's still really high, it's a private business, as you say. If there's stronger demand, you might keep just saying, we don't need to bulk bill, we're getting enough people in anyway. Did you consider a minimum level, even if it's a low one, of bulk billing, that every GP, if you want to access Medicare payments, 5% has to be bulk billing? If they want to bulk bill more, fine, of course, but did you consider a measure like that so everyone would be near a clinic that bulk bills?
Well, this is a demand-driven system, and we have, as I said, worked very closely with the Royal Australian College of General Practice, with the Rural Doctors Association of Australia, with the AMA. And this is what they've told us, that for them in order to be able to continue bulk billing or to return to bulk billing, that a tripling of the bulk billing incentive will make practices viable.
Yeah, sure, but you can do that as well as the measure I was talking about. The RACGP is never going to say, please make us bulk bill 5%. I'm just asking if you, your government, or you as Minister have considered this sort of measure.
Well, we are working very closely with the sector, including by standing up the Strengthening Medicare Task Force and investing across the board in general practice, from general practice grants so that they can improve their equipment and their IT, through to the single employer model, which is encouraging doctors into general practice. So as a government, we're looking across the board at all measures that we can do that will really help to strengthen Medicare and make it more robust. And as I said, I'm confident, from having spoken to the president of the Royal Australian College of General Practice, hearing from the incoming president of the Rural Doctors Association of Australia, that they're confident that their GPs will return to bulk billing or continue bulk billing.
What if they don't? Is that the sort of measure, again, just maybe it's a different way of asking the same question, is that measure on the table? Is it something you've considered? Would it not work for some reason I'm not thinking of?
Well, what we've seen so far, and this is the biggest investment in bulk billing since Medicare was introduced over 40 years ago. This is $3.5 billion, a tripling of the bulk billing incentive. So we're confident. Doctors want to bulk bill. Doctors go into healthcare because they want to provide care for their community, particularly the most vulnerable people. So we've worked with the Royal Australian College of GPs, we've worked with the RDAA, we've worked with the AMA to provide the sort of measures that they said will lead to a boost in bulk billing. And I'm really confident from the conversations I've already had in Tasmania over the weekend or in the Illawarra this morning that that's what we will see.
All right. Again, I'm not sure any of them will actually say they should have a minimum bulk billing level, but it sounds like you're going to wait to see if this works. Emma McBride, thank you.
Thank you.